January is Cervical Health Awareness Month. We invited OBGYN Dr. Lauren Streicher to tell us what women need to know. So it is good to see you. Thanks for coming in.
It's my pleasure to be here. Bright and early.
You're bright and early to answer all the questions.
Yeah.
Right. At least it's not to deliver a baby and it's a lot of hard work. You just get to sit there and listen.
This is so much more fun. Not that delivering babies wasn't fun, but I'd rather just chat with you.
Well, you know what? We have tons of questions about this because it's not as easy as it was when we were younger and you just went to the doctor every year.
No
and
one
you did
thought
your
about
thing.
it. No, it was you go every year, you have your Pap tests, and you just don't even think about, do I need it? Should I go? Shouldn't I go? And what's so interesting is a lot of people didn't even realize what the Pap test was for.
It is for cervical cancer.
It is a screen for cervical cancer, and for so many women, Pap test is synonymous with going to the gynecologist. And this is part of the confusion, because now with new Pap test regulations that you may not need that Pap test every year, people are like, phew, I am off the hook. That means I don't have to go. No, you still have to go. If I don't look at your cervix, who's going to? And you need to go not only so someone could look at your cervix, but to check out everything else. Because the Pap test is only a screen for cervical cancer. And as you said, we don't have enough awareness. And what we've just learned this week is that the numbers are even higher than we thought, particularly in the African-American population.
So, so what are the guidelines right now?
Well,
and we're still confused.
And what are we supposed to do about it?
I know we go to the gynecologist every year. That's hands down. But when we
this
get the Pap...
This is my first guideline. You can't keep track of this. The guidelines keep, so let your gynecologist keep track of it. Go every year and let him or her let you know if this is a Pap test year. Because it does vary according to how old you are, what your history is, what your prior Pap tests were, and it may be anywhere from every year to every 3 years to every 5 years, depending on those factors. In addition, it matters which Pap test you get. Because some Pap tests, what is a Pap test? I think people need to know that. A Pap test is simply taking sampling of cells from the cervix, which is the opening to the uterus in the back of the vagina, and looking under a microscope to see if they look normal or abnormal. But in addition to the Pap test, to seeing if the cells look normal, we also are looking to see if there is the presence of the HPV virus, human papilloma virus, which is the very common virus which is responsible for not only cervical cancer, but other cancers, vulvar cancer, vaginal cancer, anal cancer. And so the current Pap tests don't always automatically test for the presence of the HPV virus. And my recommendation is when you go to the gynecologist, if it is a Pap test year, to ask, to say, are you also going to test for HPV? Because what we now appreciate is that it really is a better test with more information so that you don't miss some of those cancers. So that's why it's not so easy to say, okay, everyone has to go every year. Everyone has to go every 2 years. Go every year, talk to your gynecologist, find out, is this a Pap test year? And if it's not a Pap test year, you still want someone to take a look at your cervix to make sure that it looks healthy.
Now, as far as cervical cancer itself is concerned, once it's detected, is it pretty easy to be treated, especially if you catch it early?
Yes, and that's the point. This is a highly preventable cancer. One of the things about cervical cancer is that there's a very long stage of precancer. We don't have that benefit with other cancers like ovarian cancer. And the beauty of this is if you get your Pap test as you're supposed to, you're going to find it at the pre-cancer stage when it is highly treatable.
Right,
So,
which is possibly
what happened with Aaron.
Well, or at some point in time early on.
And we're talking, you have years, not weeks or months, but actually years. So if women actually have their regular Pap test, I'm not saying it's never going to happen that someone, because sometimes you do get something that's very aggressive, but in general, if a woman gets her regular Pap test, it is going to be caught at the pre-cancer stage, and it is preventable. And that's why this is such an important message to get out, that a lot of cancers, you know, it's just a bad roll of the dice. But with cervical cancer, you can actually have action steps that are going to make a difference. So I have 3 action steps that are important for every woman to know. Number 1, go to the gynecologist every year, get that Pap test. Number 2, if you have an abnormal Pap test and you need follow-up, don't get scared and disappear off the face of the earth. Go for that follow-up. A lot of women, they think, oh my God, I'm not going to go in and get my follow-up testing because I don't want to get bad news. And number 3, HPV vaccine. I cannot emphasize enough. We have a vaccine that is going to prevent cervical cancer. And why every boy and girl in this country is not vaccinated is a mystery to me, because if every boy and every girl in this country were vaccinated as a 11, 12, 13-year-old, that would prevent 90% of cervical cancers, vulvar cancers, vaginal cancers. This is not controversial. This needs to happen. But the interesting question that I get a lot is the HPV vaccine is FDA approved for up to age 26. What about the older women? Let's talk about that for a minute. We have a 50% divorce rate. How do you get HPV? Well, ladies, it's from having unprotected sex. You got to protect yourself.
Right.
So what is someone supposed to do? 40 years old, divorced, out there. How do they protect themselves? Well, you know, in a perfect world, every guy would wear a condom. This is not a perfect world. There is a female condom. It's a whole other subject, which is a good subject to talk about.
Right.
But can that woman get the HPV vaccine? And the answer is yes.
Oh, wow.
It might not be covered by insurance. It is not FDA approved. But as a gynecologist, I am telling you, I am seeing way too much HPV out there, not only in terms of abnormal pap smears, but let's just say it, and those lovely warts that people are getting. This eek is right.
Yeah,
No, I know this is breakfast
We
TV.
can talk to you about this for
talking
hours.
about-
You have to come back and we'll get into all the different topics.
All the
'cause you are a
details about
plethora.
the-
You
Wow. And she puts it right out there,
Right.
too. Thank you, Dr.
Yeah,
Streicher.
thank you so
You're
much for being here.
welcome.
Check out drstreicher.com for more information.